Heads up, it's a totally new game. As I record this, I'm sitting outside, breathing fresh air, getting a few rays. I've been exposed to COVID. I'm not concerned. I have a plan. But it's a totally new game, and a new defense is now needed. A study has been presented, and I'd like to share it with you. It is a comparison of two highly effective mRNA vaccines for COVID-19 during the periods of Alpha and Delta variant prevalence. Is it reputable? You decide. This study was posted August 8, 2021. It's a study of the vaccinated and the unvaccinated individuals from Minnesota, 25,589 in each category, matched on age, sex, race, history of prior SARS-CoV-2 PCR testing, and date of full vaccination. 25,000 plus in each category. Both vaccines were highly effective during this study period. Which period? During the periods of Alpha and Delta variant prevalence. That's the mRNA 1273, 86% effectiveness. The BNT 162b2, 76% effective. Remember those two numbers, 86, 76. However, in July, the effectiveness against infection was considerably lower for mRNA 1273, down from 86 to 76, and the other down to 42 from 76. Notably, the Delta variant prevalence in Minnesota increased from less than 1% in May to over 70% in July. And this is a game changer. Whereas the Alpha variant prevalence decreased from 85% to 13% over the same time period. Is this the only study showing the failure of the vaccines during this time period? No, not so. Vaccines fail with loss of efficacy and resistant strains of SARS-CoV-2. This is Israel confirmed cases. July 4th through July 31st of 2021. We look at the age groups, cases fully vaccinated, cases unvaccinated, percent of cases fully vaccinated, and percentage of population fully vaccinated. So let's look at the first age group, age 20 to 29. Cases fully vaccinated, 2,689. Cases unvaccinated, 795. So the percent of cases that were fully vaccinated, that's 77%. Of those who've tested positive between July 4th and July 31st, 77% were fully vaccinated. In the last column, the percentage of population that was fully vaccinated was almost 72%. What are we learning? This is a report from Israel of confirmed cases between July 4th and July 31st. So in this young age group, 20 to 29, there were 2,689 reported cases of COVID that were fully vaccinated. 795 cases that were unvaccinated. And the percent of cases fully vaccinated, 77%. The general population fully vaccinated, almost 72%. You can look at the various age groups, but from age 20 to 90 plus, there were 15,634 cases that were fully vaccinated. 15,634 fully vaccinated cases, and 3,038 cases unvaccinated between July 4th and July 31. Percent of cases that were fully vaccinated, 86%. 86% of people who were identified as positive tested were fully vaccinated. And the average population, 84% fully vaccinated. The source of this, you can see it down there. It's from the dashboard.health.gov.il, that's Israel/COVID-19/general. This is public information. The report that I quoted from Minnesota is not an outlier. So this is a new game. We need to approach this in a new way. A new strategy is needed. And there's no reason to be fearful. Hospitalization and death are preventable if there is early treatment. It is critical. Do not wait. Look at this report from the CDC, the Center for Disease Control and Prevention. COVID-19 vaccine breakthrough case investigation and report as of July 26, 2021, more than 163 million people in the United States have been fully vaccinated against COVID-19. During the same time, the CDC received reports from 49 U.S. states and territories of 6,587 patients with COVID-19 vaccine breakthrough infection who were hospitalized or died. Hospitalized or fatal vaccine breakthrough, 6,587 cases as of July 26. Notice 48% were female. That's 3,193. 4,868, 74%, were people who were age 65 or older. Asymptomatic infections, 19%. Hospitalizations, 6,239. And deaths, 1,263. This is dealing with people who are fully vaccinated. Treatment is the name of the game. Early ambulatory multi-drug therapy reduces hospitalization and death in high-risk patients with SARS-CoV-2, COVID-19. Early ambulatory COVID therapy, what was expected and what was realized? A 74, almost a 75% risk reduction of death for those who were treated early. 87+% risk reduction. Hospitalizations. Expected versus real. The orange-brown is what was expected, and reality, it is what is shown in blue because of early treatment. The thing is, there is no official recommendation of how to treat COVID other than wait until you're so sick you have to be hospitalized, put on oxygen, and put on a ventilator. That is the treatment. Early treatment is the key. We can't wait for long-term studies. We need to use what we know works based on history. So, if you have COVID-19-like or COVID-19 confirmed illness, self-quarantine at home, contact tracing, contagion control, ventilate, fresh air, reduce re-inoculation. So I'm sitting outside, breathing deeply. Breathe in slowly through the nose. Hold it for 4 seconds. Exhale through the mouth slowly for 9 seconds. Open up the lungs. Clear them out. There are lots of natural things that can be done. This is a revelation of what can be done using medicines that are already available. So depending on your age, look at the left. If you're less than 50 years, watchful waiting, unless if symptoms worsen, and complete your self-quarantine if they did not. Down the center, if your age is 50 or you have a single comorbidity, as listed there, or to the right, greater than age 50 with greater than one comorbidity. So here's a listing of things that you can be doing at home. And if feasible, and it is very feasible, get the infusion of the monocolloidal protein that can be placed in your system on an outpatient basis. With a referral from a physician, you go in and get the infusion and then go home and practice a healthy lifestyle. I have checked. This is available at Ray Medical. It's available in lots of places, not just in East, Middle, and West Tennessee. Immediately start with 2 or more of these anti-infective agents for 5 to 30 days. If you have respiratory symptoms that develop, or day 5 of illness, either way, additional treatments. And if things escalate, additional things you can do. That's the closest that I'm going to get to offering medical counsel, because I'm in no position to offer advice. This is for educational purposes only. But the fact is, hospitalization and death are preventable if there is early treatment. It is key. Do not wait. Hot and cold showers. Hot showers for 3 minutes, and then a cold shower for 30 seconds. Repeat it 3 to 5 times as you can tolerate it. It will build your immunity. Do all the vitamin D, vitamin C, the zinc, and so on that was listed above. We don't need to be fearful, but we need to treat early. How many times have you had a cold and just treated it at home? You don't just go untreated until it escalates to the point where you have to be hospitalized. So my friends, we're in a new game. It doesn't matter if you've been vaccinated. It is not, according to these studies, it is not a good defense against the Delta variant. So, with that, I challenge you to do your research. If you want more information, I can send you some links. Blessings to you and have a great day.